We're with Dr. Manjula Jegasothy from Miami talking about non-surgical body contouring. Manjula, your patients in Miami have really workouts on the beach. They spend time at the pool and the beach, and they're really thinking about body contouring on a regular, everyday basis. So talk to us about your evaluation with your patients.
Absolutely. You know, it's so interesting because surgical body contouring has always been the past, and now with all the great technological advancements in non-surgical body contouring, I really think it's become the real purview of us as board-certified dermatologists to take charge of this field. You know, my patients come to me with so many of the new ideas and innovations that I create every month with the materials and machines that I have already to make their bodies look better.
So from a standpoint of patient populations, we have patients hiking, biking, skiing, wearing Gore-Tex and wearing fleece, and then all of a sudden spring comes around and people might be more concerned about their appearance and what they can do. So talk us to your short-term plan and sort of your long-term plan.
Sure,
with these
and
patients.
what's interesting too is, you know, as I get more celebrities in my practice, they're showing it off all the time. And in my lecture, I kind of showed, even if you're on the red carpet in a long dress nowadays, your midriff is exposed, or if you've got a thigh-high slit up to here. Or, so, you know, really there has to be both long-term and short-term goals, as you mentioned. So, you know, I'll do something quick like an Ulthera body lift. I do it on the breasts, I do it on the buttocks, and that can be something that's done with no downtime, and they're literally okay and good to go the next day and look better in their dresses or whatever, their bathing suits already. And then there's some more long-term things. I love the reaction laser from Viora for skin tightening. It's excellent for doing small areas like the elbows and the knees, the knuckles and the hands. A lot of people think that, you know, hand aging has more to do with volume, but I really think early hand aging has a lot to do with skin laxity. And so those procedures, the results may take a month to 2 months, so you need to plan out a little bit earlier.
So these are all areas, breast lift, butt lift, in terms of some of the laxity of the skin around the elbows. There isn't a lot of data, so really how do you talk to your patients about specifically expectations, because these are not generally home runs?
Totally. I think that you have to be very good with patient selection, and that's really, I think, why I get good results. And then, you know, you show them before and afters that are really related to them in terms of their skin type, their age, their, you know, the amount of sun exposure they've had. And if you show them realistic before and after pictures that don't show, you know, a home run necessarily, they're happy with a 30–40% improvement with any given treatment if you manage their expectations appropriately.
And give us 1 or 2 quick tips on really how to do standardized photography off the face. We all have these expensive camera systems for the face. When it comes to showing patients before and after, when we're not using the face as an example, what do you do in your practice so that you really have quality photos to show to your patients?
I recommend to everybody who's interested in doing studies or lecturing or even just for their own social media and marketing purposes to have your entire staff trained by some sort of either a publication, or a lot of the pharmaceutical companies that sell these lasers will send someone out to your office and train you, and they basically set you up with a black screen and show you how to set up. Nowadays with a simple tripod and an iPad, you can get magazine quality publications that are wonderful, and just, you know, a light that you attach to the iPad. And so I recommend that everyone do that, and they standardize it. They can give you squares for the patient to stand on and turn, and it actually makes it quite user-friendly.